Hi there, everybody. I thought today I would talk to you about one of the most common questions that's asked in our clinic around this time of the year, which is what is the difference between colds and allergies? And there is a difference. In the past, people used to think that allergies came around spring and fall, environmental allergies at least, but now we're seeing that people are actually having environmental allergies throughout the entire year. So it's a little bit more complicated now, but it's also very, very important to know the difference between colds and allergies because even from a naturopathic perspective, we treat the two very differently. One of the things that you can look for is mucus color. Mucus color is an easy giveaway to figure out whether you are having a cold or an allergy. So allergies will usually present with more of a thin or clear mucus discharge. So if you think about running eyes or watery eyes, if you think about sneezing, or you think about if you're blowing your nose and there's a clear discharge, that's usually an allergy. If you think of itching symptoms, that's usually related to an allergy. So you think about hives, people will often have itchy ears, they might have itchy eyes, they might have itchy skin in other places, and this is usually related to an allergy. Colds don't usually have itching related, and the mucus in colds is usually a little bit more green or yellow even. Oftentimes colds have a thicker discharge, so thicker mucus. So that would be one of the ways that you can tell the two apart. One of the things that people often ask us are how would you treat these two entities? And naturopathic tips for things like allergies would probably include something like quercetin, bromelain, and vitamin C. These all have an anti-inflammatory property and will help to stabilize the mast cells that are involved in allergies and inflammation. When you think about colds, think about using things that are boosting the immune system. Our favorite herb of choice is astragalus. We've seen a lot of benefit with astragalus in all sorts of different conditions, but colds really benefit very, very well from this. A lot of people really prefer echinacea. Some people prefer oil of oregano. Both of those are a hit and miss for people. We haven't seen as consistent results with them as we have with astragalus, but some people absolutely love the effects of these on their immune system. It's important to note with echinacea, it's very important to use it only in the early stages of a cold. So up to about 10 days of a cold, it's probably safe to use echinacea. After that, you're getting less benefit with using echinacea, so be very careful that way. Other people also have a sensitivity to echinacea, so an allergy in fact. Make sure that your cold doesn't become an allergy because you're taking echinacea. And that's one of the most important things to remember, that whatever you're treating, make sure you understand what you're treating, and how to treat it will depend on your diagnosis. So try to make sure that you understand the difference between allergies and colds, and I hope this has helped you. I'm looking forward to seeing you next time for another piece of your healthcare puzzle.